afternoon, Senator Dinsmore. My name is Leslie Phelps.
Hi, it's nice to meet you.
I just wanted to take just a few minutes of your time to discuss House Bill 15.
Okay.
House Bill 15 was passed during the 82nd legislation and signed by Governor Perry and became effective October 2011 of this past year. House Bill 15 requires each abortion provider to perform a sonogram on a woman seeking an abortion. The sonogram has to be performed at least 24 hours beforehand, and the physician must provide verbal explanation of the images, and the heart auscultation must be made audible to the patient.
Yes, I'm familiar with the bill, which seeks to shame the woman for her choice, not help her make an informed decision.
House Bill 15 would ensure that a woman considering abortion has access to all of the medical information that could influence her decision. The bill would provide them with the same kind of medically accurate information applicable to any surgical procedure, including risks and benefits. House Bill 15 protects and ensures that women make informed decisions. They can choose not to view the sonogram if desired.
Well, requiring a woman to submit to a potentially unwanted sonogram in order to receive another medical procedure would create undue burden.
Some women report that they would not have had the abortion if they had known more about the procedure and the development of the unborn child. Informing a woman fully of her unborn child's gestational age and development could reduce the number of abortions.
The bill violates the free speech rights of patients and physicians by making the patient a compelled listener and the doctor a compelled speaker.
House Bill 15 actually is constitutionally sound. The bill allows a woman to leave at any time she chooses, so she would not be a captive audience. Performing a sonogram is already the standard of care before an abortion procedure, and this bill only formalizes that standard.
But don't physicians feel that this threatens them with criminal prosecution and loss of their medical license if they fail to obtain informed consent of a woman who seeks abortion by giving them visual or auditory depiction of the fetus beforehand?
I believe that physicians should feel a sense of responsibility to provide this information as part of their practice. My main goal is to protect the patient population of women who are gestationally viable but diagnosed with an unviable infant, say, for example, trisomy 13 and 18.
So you have my interest. Please go on.
Developments in prenatal diagnostics have increasingly allowed fetal abnormalities to be diagnosed. Parents are confronted with traumatic and emotional choices and should be given all the information they need, including options such as delivery with the home care of hospice until the infant passes. One study in particular demonstrated that termination of pregnancy due to fetal anomalies in the second trimester is associated with post-traumatic symptomology. I believe that many women go uninformed of this circumstance, and while House Bill 15 affects a multitude of situations, in this case it's imperative that we support it.
Leslie, I will consider supporting this bill and further legislation focused on certain patient populations.
Thank you, Senator Dinsmore. I'll be staying in touch and keeping you up to date with these developments.
Okay, good luck.